Hey guys, Dr. Schulte here. Quick tip today for those of you who are on Synthroid or Levothyroxine. There are so many of you out there on that medication who went to your medical doctor hoping to get some relief from maybe it's weight gain or skin issues. You couldn't sleep, you're irritable, all of these different thyroid conditions, thyroid symptoms that people notice. And you're on that medication, you were put on it hoping to feel well, and you still feel awful, oftentimes even worse, but you feel like there's no answer out there. What I want to give you today are some of the reasons why you still may not feel well. So number one is the very first thing. I would hope that your medical doctor checked you for adrenal insufficiency before they put you on that medication. That is a major contraindication, and I'm finding with all of the patients that we come to us for hormone, thyroid issues, fertility issues, a lot of times they're on that medication, have been for years, and they've never been checked for adrenal insufficiency. If you're interested in that, I have another video out that I put out all about the details of that. So that's one. But if you have been checked for adrenal insufficiency, you're on that medication, and you still don't feel well, then there are three contraindications to ingredients within that medication that you may not know about that may be causing those issues. Number one is, it comes from the tree or shrub family. It's called acacia. Acacia, typically people who have sensitivities to that, or those of you with seasonal allergies or asthma, you're much more prone to having a sensitivity to that, specifically a sensitivity to ryegrass. That's also very common in people who are allergic to that. Number two is the one that's probably the most common, and that would be a lactose allergy. So those of you who are lactose intolerant, maybe you notice that when you eat dairy, you don't feel well. Maybe you bloat, have abdominal pain, cramping, things like that. That could be a lactose sensitivity that you're noticing from that medication. Think about it. If you notice that when you're eating those foods or drinking that milk, you get all those symptoms, you're putting that medication in every single day, and your body has to react to that. And so typically if you have a sensitivity to that, you'd notice a symptom maybe 30 minutes to 2 hours after taking the medication. Please be on the lookout for that, because that's a very common one that oftentimes isn't checked. And number three is an ingredient called cornstarch, which a lot of you have heard of. It's not really the cornstarch. The ingredient, if you look in the ingredients, is powdered sugar, but cornstarch is in that powdered sugar. Now, where that comes into play are those of you who are allergic to corn allergy. So corn itself, but not only corn, but those of you that cornstarch can actually cross-contaminate with gluten. So celiac disease is oftentimes involved when you have Hashimoto's or Graves'. There are different digestive issues oftentimes if you have a thyroid issue, but I'm telling you that cornstarch could be affecting it as well. So please get checked for those things. We have food allergy testing in our office. Just a quick example, I have a patient who was on Levothyroxine, Synthroid, on all these medications. They ran, again, simple tests like a TSH and a T4, very, very limited in being able to really get a full picture of what's going on with the thyroid. So we test about 10 to 15 different markers in the blood when we're looking for thyroid, so we can actually find the cause of the problem. But she had those two tests run. She was thrown on that medication like so many of you are. She felt awful, had never had her food allergies tested. Specifically IgG, which is not something that you're going to get at your medical doctor, but we have very specific tests that we run. She had a very, very hypersensitive reaction to corn, and that's one of those in that cornstarch. So I'm telling you, you're taking that medication every day, you feel awful. So another really common one is eggs. So we see that all the time in the food allergy testing that we have. These people are on that medication. I'm telling you, there is a better way to that. There's a time and place for medication, but for those of you who are still feeling awful, those of you who are sick of being on medication and really want to get to the root cause of the problem, that is what we do in our office. That's what offices all over the country, Wellness Way, are the offices that we're called. I'm telling you, we're transforming lives. People who are suffering just like you deserve a better answer out there. It's so rewarding and so fulfilling to be able to help so many of you, men and women, but in particular women with, like I said, the thyroid issues, hormone issues, fertility issues. You feel like there's no answer. Our goal is to get to the bottom of the problem, find that root cause. There's always a root cause. Do the proper testing, give you very specific herb supplementation, diet recommendations, exercise. We use chiropractic care in our office to help boost that body's own internal defense mechanism. restore that communication and health back to the body. All of those are different pieces of the puzzle that really work together. But I'm here to help those of you who are suffering. My wife was one of those who was really suffering, and we spent the last 5+ years really perfecting. Every case is uniquely different, but really my goal is to optimize and shorten that path to that healing for you. If you're interested, please give our office a call. Whether you're in Nebraska or around the country, we help people all over the country. I'd be happy to help you. There are offices all over that can really do the same. So I'm here to help you. I hope that gives you guys a quick tip. Please share that information. Share this video with those that you care about, because there are other people just like you suffering out there. If you have any questions or comments, please send them below. I'd be happy to help you. You guys have a great day. Take care.